Was there like
So
was there a moment for you that where you were like, oh wow, I'm missing out on a lot? Like, did you sit on a surgery or something that kind of was like, oh
yeah,
my
it was
God?
when I first started touring our ICUs, because one of our businesses was we provided critical care services to 3 different hospitals, and so it's one thing managing provider compensation, and there's nothing more deflating than cutting paychecks for physicians all day. It's like, oh, he made that
Here's the
much this
money.
month.
Yeah.
I'd have made that all of last year.
Right, exactly.
So that's great and all, but like actually getting to go into an ICU and having to put on all the gear and go into their world and see what they're dealing with, it made me. It truly made me see like, okay, they're doing this for 12 hours a day for 5 days in a row. Like, okay, I get it. It
I
makes sense
understand
now.
now.
Yeah, I understand. I used to have one physician that would take calls like, while he was with the patient, it would always trip me out. I'd go, no, 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 just call me back, call me back. Like, I don't need to talk to you right now. And he's like, he would just put it on speaker. And he's like, no, 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 it's okay. They're intubated. And I'm like, no, 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 no. I know internally I would be freaking the hell out if somebody was trying to call me while I was, working on a patient. Like, but for those guys, it's, they can do that in their sleep.
There was a
Um,
physician, I think, I forgot where it was, but he had like a traffic fine or something like that. And he zoomed from within the operating room for this court date for his like traffic ticket. And he's like, hello, judge. I'm coming in the middle of
no,
something, but I plead guilty.
that's incredible. Well, and it's funny. One of the things that they taught at our health system is that when you work directly with patients, there's this idea, this concept of being on stage versus off stage. And so the version of yourself that you present when you're in a facility, they would say, not even with a patient, but just in a facility in general, like you're on stage and patients have the ability to see that, which is different than the persona that you carry when you're off stage. And so I remember when we were having the birth of my second child, and still vividly, I remember it vividly, but like with my wife was having a C-section at the time, and she opened up, and the physician is sitting there asking the other physician, like, have you been to the new breakfast spot in that one part of town? We're gonna go after this. And I didn't know, have you been there? And I was just like, are they seriously talking about brunch right now? Like,
Like the worst possible time ever.
yeah, and that wasn't even the worst, because they then segued. The guy goes, you know what? I have ants that are just like going, like, did you lay like a fertilizer or some sort of thing around your property when you, and I was just like,
Like, what do you think, guys? Should we talk about something else here or
yeah,
what?
yeah, yeah. Can we focus on the job? But this is their, 1 millionth of these, they've done. So I totally get it. But the point of all that is that I finally got a chance to work with patients directly because of COVID. There was an opportunity where it was all hands on deck with a lot of things that we were doing. I had actually shifted a little bit out of the partnerships and assisted with our telehealth team and helping essentially push out and roll out our virtual health initiative at our health system. And so it really was an all hands on deck experience of all of a sudden shit hit the fan across the entire country. Nobody is supposed to be seeing anyone in person or touching anyone or breathing or physically 6 feet apart. And so how do you do care like that? And so there was about a week or two where all of our ambulatory and outpatient clinics had to be shut down. And we had to shift. There was a big pivot to say, okay, well, how do we continue this? Because we're going to lose a shit ton of money if we can't figure this out quickly.
Yeah,
And
and
so we
before
had,
before you go forward, I know, so it's confusing. So you were you were working with Medicare risk adjustment, and now you're somewhere else, which is where are you working
ah,
for?
yes, that is correct. So sorry, I was working in Medicare risk adjustment, and I actually ended up getting out of that space to join an actual health system. So my previous role, I had worked with a third party entity that would partner with health plans to help adjust risk scores, and we would partner with health systems to do their coding and auditing. But that was really a third party organization that did that, just like kind of an independent company. And then I was traveling a lot. I was working remote, and I'd had 2 small children, and so I wanted to work somewhere more local that I could actually just kind of go into the office and not travel. So I ended up joining a local health system here in San Diego, and my immediate role with them was to manage our critical care units that we were partnering with regional hospitals in the kind of greater San Diego County and Riverside County and Imperial County areas. And so that was my first role here locally within an actual academic medical health system here in San Diego.
Yeah, now you progress to transforming, in dealing with COVID, and now you're moving into telemedicine, and all these like shit basically hit the fan.
Yeah. So I'd been managing our partnerships with our health system, and we had multitudes of service lines, and a lot of the work that I'd done previously in the risk adjustment space was managing teams, managing providers, managing call centers, managing schedulers. There's a lot of operational piece of risk adjustment that was really kind of a provider operations type role. So it was a nice segue to join an organization where I was now managing a team of physicians that were going into an ICU and performing critical care services there, and managing all the different elements of their administrative aspects of their operational work. And so that led to managing other affiliations, managing other partnerships, and then did that for a few years until, as we said, COVID hit. We had a transition into telehealth, and that was a big shift. That was us moving from in-person to virtual care. A lot of moving pieces there, and then eventually to where I really got to work with patients and the public was when there was a vaccine that got developed, and that shifted me out of kind of assisting partnerships and telehealth into operational aspects of helping run our vaccination superstations that we had created.
Yeah, and he's kind of undermining it here, but he said he had set up this very large. It was in parking lots, I'm assuming. Was that where you guys
Yeah,
were?
it was a partnership with the not only the San Diego County, but also with the San Diego Padres to help kind of identify a location where we could utilize space. And it wasn't just happening here. This was a model that was being rolled out across the country. And so a lot of emergency management, and I really have to give credit to the emergency management teams across the country, and kind of the individuals that work in city planning. There was a lot of instrumental people that were just such a huge role in helping get that off the ground.
Yeah, and they created the super center for vaccines, and just getting people to access of care. We talk about that quite a bit already, and access to care is super huge. And if people weren't able to get vaccines, they're not able to get, if they want the vaccine and they want to protect themselves, they need access to it, plain and simple. And so what they did and provided vaccines for thousands and thousands of people. I don't know if you know the number of how many people.
I want to say we ultimately was around 350,000 is what we did. And That was just us. I mean, there was a collaborative effort with other, the 2 or 3 other major health systems here in San Diego. I mean, we were the first one to get our station up and running, but like shortly right after, I mean, the other health systems were right there with us. There was a big, I think like Sean Penn was the one who set up the core response team in Los Angeles, and they were the ones who worked there in Los Angeles at the Dodger Stadium, and and that was an independently run firm and based completely off of like celebrity donations and money. It wasn't like a partnership with a health. I mean, it was really truly like everyone. It was a true sense of all these communities coming together to achieve a common goal and to get humanity back on track.
Yeah, and did it further instill in you that you felt like you knew you were in the right place in regards to your job, your occupation, and everything that you do?
Yeah, no, absolutely. I wouldn't change this for the world. I mean, there's been a lot of lessons learned in this whole process. I will say that there was one element of this was just like this. You should always be pursuing a constant state of learning, and I would say that I absolutely achieved that with this role. I learned all these individuals and teams that I weren't even, I mean, before I helped and assisted in this, there were teams that I didn't even know existed within our health system. I was like, oh, I didn't even know we had a department of this that, we worked with. And so, getting to wear that collaborative hat and to sit down with teams of all different aspects and walks in life to achieve a common goal. I mean, it truly felt like like a military operate, like a mobile military command operation where we are going to a destination, setting up a command center, and you've got to work through logistics, supply, staffing, anything and everything logistical that you have to kind of plan out from, lighting, electrical, flow. I mean, everything is you, and you need the expertise of those that have done this before you to really lean on them to say, like, how do we do this best? How do we do this most efficiently? Do we do this via walk up? Do we do this with everyone in their cars? Like, how do we, plan for it, and a lot of trial and error. None of us had ever done this before, so it was a lot of trial and error.